Clients with Parkinson's disease have a progressive degenerative type of disease where neurons in the cerebral cortex begin to atrophy. It's a dysfunction of the system that coordinates motor activities. So the patient has an imbalance of dopamine and acetylcholine within the brain, and the dopamine receptors are actually decreased in the basal ganglia of the brain. Production of dopamine is also decreased, so dopamine cannot inhibit acetylcholine, and because of this fact, you see the inhibitory and excitability of muscle activity. So the problems that these patients have is an imbalance of this dopamine and excitatory or cholinergic activity. And when it gets out of balance, then the symptoms of Parkinson's are seen, which we're going to talk about on a later slide. Typically this happens when there's destruction of those neurons and the amount of dopamine is not available. There's really no known cause. It's possibly a genetic or viral link, could be a vascular or metabolic type of a disorder, or could be related to an environmental type of a thing. It's the second most common neurodegenerative disease after Alzheimer's disease. About 60,000 new cases are evident every year, and probably overall about 1.5 million people in the United States have the disease. Symptoms typically will develop in the 50s, and about 1% of all people that are over the age of 65 will actually have Parkinson's disease. Our case study for this neurodisorder is a 76-year-old patient who's a widower, who's retired from the railroad and has requested a medication refill for his Parkinson's disease and was diagnosed 2 years ago. The typical triad of symptoms that are seen with Parkinson's are tremors, rigidity, and bradykinias. In other words, the patients have problems with slow movement and postural instability due to these. About 70% of all patients will also have resting tremors as one of their chief complaints when they're seeking treatments. So this can also not only affect all the extremities, but can also affect the head. The face tends to be more of a mask-like type of a fixed and rigid type of a position due to the problems that they have. Your textbook has some great information on symptoms of Parkinson's, so please see your textbook for some further information also. As we said, one of the early symptoms are tremors, most typically seen in the upper extremities. Patients may also have a pill rolling type of emotion with their fingers. Can be somewhat controlled with purposeful voluntary movements. Tends to get worse with stress and anxiety, and the patient may have progressive problems with their tremors to where writing and eating is very difficult for them. The muscle rigidity is due to an involuntary contraction of skeletal muscles. They have problems with resistance to range of motion. Skeletal motor movements become very jerky. And one of the early signs is the patient develops muscle cramps in the toes and the hands, where the hands and muscles will feel stiff, achy, or heavy. And as we talked about early, the patient may have a mask-like look to their face due to the muscle rigidity problems that they have. Problems with bradykinesia include that the patient has slow-moving ambulation. They have a hard time getting started walking. And continuing and coordinating muscle movements. So typically these patients will have that shuffling gait and have a stooped posture, and they will also have problems with chewing, swallowing, and speech muscles. They may note to have increased salivation and drooling, and movement problems with eyes, mouth, and voice. Propulsion issues with walking are a problem with these patients. They start out walking slow, but then they have a hard time getting stopped with their walking, so a lot of gait issues. These are some pictures of some of the symptoms. The middle one, B, is showing you that pill rolling movement that they typically will have with their hands, and C is showing you the shuffling gait that's common with these patients. 50% of all patients with Parkinson's will have issues with depression and fatigue. problems with increased sweating due to that dopamine acetylcholine imbalance. Constipation is an issue, urinary problems, orthostatic hypotension with position changes is very common. Skin changes, dementia affects about 1/3 of all of these patients. They may be confused and disoriented and also have memory loss. Problems with judgment, and problems with sleep disturbances. And once again, this is due to those imbalances with acetylcholine and dopamine. It can't be treated with just an oral dopamine compound because dopamine actually gets metabolized before it reaches the brain. So what they're actually treated with is a precursor to dopamine, which is called levodopa, also known as Sinemet, and this actually will convert to dopamine once it gets into the brain. Patients will also be put on anticholinergic meds such as cogentin and artane, and these meds will both help to balance the acetylcholine and dopamine imbalance. So the acetylcholinergic drugs will help with the tremors, rigidity, drooling issues that these patients have and those types of things. One problem with Sinemet or levodopa is that patients within about 5 to 10 years may develop a decreased response to this medication. So you may start to see once again problems with facial grimacing, jerking of the hands and that type of thing, different types of dyskinesias or involuntary movements. So sometimes what's needed is the patients are actually brought into the hospital. The medication is stopped for about a week. We call it giving them a drug holiday, and then they're restarted back on their levodopa at a lower dose, and sometimes this will actually help when they've developed a tolerance to that particular medication. Other medications these patients are put on are dopaminergics, which will actually help with increasing mobility. And as we said, levodopa is one of them. Symetrel is another drug in this category. MAO inhibitors may help to help with dopamine in the brain, and those examples of those drugs are listed there for you. And we've talked about anticholinergics are used to ease the tremors, drooling, and rigidity. So dopamine agonists such as Permax and Parladel may also help with those receptors in the brain. So patients need to be taught with what the side effects are, to take the meds with meals to help to decrease GI upset, some measures to relieve dry mouth, because remember anticholinergic drugs are going to cause that. So mouth rinses and using sugar-free candy may help. And due to the anticholinergic meds, they also may have issues with constipation. So they need to be on a bowel regimen for that. And they need to report to their physician any symptoms such as dizziness, which could be due to postural hypotension, spasmodic twitching, facial grimacing, tongue protrusion, those types of things. Those are common symptoms of Sinemet, Symetrel, or Parladel when those dosages are not appropriate for the patient. For patients that cannot be only managed medically, then the patients may need surgical management. It may provide relief of symptoms. It's not really going to cure their Parkinson's, but it may help with the symptoms that they have. The first surgery that's listed there for you, thalamotomy, I'm really sorry. The first surgery listed there will actually destroy tissue and will help with improving walking and tremors that the patient may have. A pallidotomy is actually where it's going to help to destroy the tissue that also in the brain that will help with walking and tremors. And thalamic deep brain stimulation is where electrodes are implanted into the brain and attached to a generator to control tremors. Something that's experimental and maybe an option for in the future are fetal transplants. It's where they actually use fetal cells and they actually will do neural transplantation of these fetal brain cells into the brain of the patient with Parkinson's to help with dopamine release. These would be appropriate calls for nursing for the patients with Parkinson's, nutrition related to impaired swallowing, so supervising meals, small frequent meals, increasing fluids and fiber, and remember to tell that patient as part of teaching that they should not take alcohol with their Parkinson meds because it will decrease effectiveness of those drugs. Physical mobility we've talked about is an issue, so getting them involved with with physical therapy and occupational therapy is going to be helpful. We want to try and have them do their activities when their medications are at their peak action levels, and also get them assistive devices to help with ambulation and meals as appropriate. Verbal communication will also be an issue, so we'll get speech therapy involved for that. We may go ahead and, if they're still in a home situation, have that patient have an emergency call system where if they would fall or have problems, that they could use that. And communication methods include flashcards and paper pencil, communication boards, those types of things. We talked about depression and self-esteem issues earlier being a problem, so getting them into support groups will be helpful. And the first NCLEX question says, which of the following goals would be the most realistic and appropriate when planning the client's nursing care? Correct answer here is number 4, to maintain optimal body function. And the next NCLEX question looks at the client who started on levodopa therapy and that the nurse would evaluate that the drug is exerting the desired effects when the client has an improvement in which of the following. And that particular med is going to help with all the muscle rigidity problems. So number 2 would be the correct answer.